dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View.
I'm Yvonne Dunitz. Welcome to The Health View. In this special segment of The Health View, my guest today is Mike Affelberg, the CEO and Executive Director of the United Way. Welcome, Mike. It's great to have you here with us today, and I know that the United Way has been doing some amazing things related to saving people's lives in our really unusual time of the COVID-19 experience that we're having. And I'm delighted that you're here with us today so that you can share with our listeners and our viewers what are the challenges and how you've risen to the occasion to help save lives and to help our greater Nashua community.
Well, thank you, Yvonne, for having me on your show today. It's a real honor. I always love coming and talking with you about topics. I know the last time we spoke, I don't think either of us could have predicted that this would be today's topic, but we all sort of do what we have to do, and I appreciate you bringing me on to talk a little bit about what we're doing in the community at United Way.
So you've dealt with a variety of things. One of the most important things for you, is it the food aspect, the housing aspect? What would you say is really a critical need that you are meeting right now in an amazing way with your staff as well as your volunteers?
Well, I'm going to give you, if that's all right, a long answer to a very short question. What I would say when I preface this is, I would say that our United Way has been around since 1930. We were founded in the Great Depression. We were founded as a result of a tragedy in our community, the Crown Hill Fire. And that fire took down about half the city at the time. So we rose as an organization in response to a crisis. Since that time, we've not really had any crisis like that to hit Nashua as far as a natural disaster would be concerned to respond to. We've been in sort of 70 years of trying to improve our community. And so our United Way, like every other organization, has evolved to solve problems as they arise. Well, dial forward to 2020, and we have another natural disaster on our hands. And we find ourselves responding, I would say, as if this was in our DNA. I have an amazing team and an amazing board of directors. We're a small organization. On staff, there are only 3 of us, myself, my colleague Liz Fitzgerald, who's our Director of Community Impact, and my colleague Sarah Caesar, who's our Director of Community Engagement and Volunteerism. And the 3 of us have basically transformed the organization into an organization that literally 100% of what we're doing right now is in response to coronavirus. We're not doing anything at all that we were doing 2 months ago. So I'll take you through a list of some of the things that we're doing, if that's okay. And I'll start with food, because food security is really where we dipped our big toe in a very big way into the COVID-19 response. It started for us as being a partner with the Nashua School District to help support the needs of students in the community who, because schools are shut down, no longer have access to lunches and breakfasts at school. And I'm not talking necessarily about free and reduced lunch. I'm talking about all kids. Whether they're buying their food or whether they're getting it subsidized, they're getting it at school. So they went from that was where they got their food to that was where they don't get their food almost overnight. And so we've partnered with the school district and a couple of other partners, including the Soup Kitchen and the Boys and Girls Club, to ramp up a program where we're now delivering food, distributing food at 10 different school locations 3 days a week. Those are schools like Dr. Crisp Elementary and Pennachuck Middle School, Lead Street Middle School. So there are 10 locations that have food where kids can come and get a breakfast and a lunch for 2 days, because it's every other day. And on Fridays, they can even get 3 days worth of food. And in a number of the locations on Fridays, we also have frozen meals for the weekend and fresh produce for the weekend. We've expanded upon that initial program to add 16 more locations in partnership with the Nashua Transit System. So we've identified 16 locations that are on 4 different bus routes that I pulled out a map of the city and I said, where are we not? And I picked some locations that I thought would be good where there is a high density of people, some of it because of also low income, but also some of it just because there's a high density of people living there that weren't being served. And so we've added 16 stops to those 4 routes, and those are also 3 days a week. As of yesterday, we've peaked out at 40,000 meals that we've distributed in the 3.5 weeks that we've been running the program. 40,000 breakfasts and lunches that have gone out to students through this wonderful collaboration of volunteers from United Way, the Soup Kitchen, the Boys and Girls Club. Soup Kitchen helps with providing the produce and the frozen meals for the weekend. And the Boys and Girls Club helps to get the food from Nashua North, where it's prepared, some of it's prepared, to some of the schools that don't prepare it themselves, and the school district itself that prepares the food. So we have about 150 volunteers engaged in this effort, which has just been a really remarkable collaboration. So we started building on that. That was just the very first step. That's the tip of the iceberg. I said it's going to be a long answer. I can keep going?
Please.
Okay. So the next step was we started to identify that there are kids who have families who either can't access those locations because of transportation issues. Even though there are 26 spots in the community, they still might not be able to get to one, or their families are quarantined and sequestered due to coronavirus. So we've now expanded on the program so that we have 30 kids who are getting food on those same days, Monday, Wednesday, and Friday, from this program, home delivered by United Way volunteers. And that's really helped out as well. From that, we decided, well, if we can home deliver breakfasts and lunches from the school district, maybe we can home deliver from the pantries as well in our community, because we have clients of the Soup Kitchen and Shelter and Corpus Christi Food Bank, the Toll Street Mission, and the Salvation Army. Well, they're not normally in the delivery business. They're in the business of people coming to them to get their food. So we've partnered with all 4 of them to now deliver to people's homes, if they can't get their food boxes when it's needed. And we've done that with over 40 clients in the community. And that's on an as-needed, on-call basis. Again, they'll reach out to us. We'll dispatch a United Way volunteer. We'll get them the food brought to their home. So that was great. And we decided then, well, that's not enough either. What about people that are homebound and actually need to purchase their groceries? Because not everybody gets their food from a pantry, right? And a pantry is really only supplemental. There are people that are on public benefits like SNAP or WIC who still need to get food and might not have access to transportation or might be quarantined. And we have other people who might pay for their groceries normally. They might go to Market Basket and pay for their groceries, but they might not be able to now, again, because of transportation or quarantine. So we set up a program called Shop United, which is an online grocery shopping program that's volunteer driven, completely unique. I don't know of any other community that actually has a program like this. I certainly don't know of another United Way that's done this. We just did this on our own. If you go onto the system, you can order your groceries and you can specify how you'd like to pay for that. And if you're on public benefits, we actually come to you and we've found a way to get a waiver to use your EBT card. We can get your card and we can go pay for the groceries. Or if you've paid, we can do that. You just write up your shopping list and I have volunteers that'll go do the grocery shopping and bring it to you. No charge, no fee, just keeping people safe in the community. Again, all through volunteers. The last thing we've done on food, which is another really great partnership, this time also involves the YMCA along with the Soup Kitchen, is we've established 8 locations in the community where 4 days a week in the afternoon, we have fresh produce for people to come and get from the community. So we'll set out in two different locations on each of these 4 days, a whole bunch of produce supplied by the soup kitchen, and people will just come and get what they need, get their produce. Might be lettuce, might be tomatoes, whatever is available. It's kind of like the community CSA that you don't pay for. So that's what we're doing with food. It's a lot with food. Why would we do this? You know, I come down to 2 specific reasons why we're so actively engaged in food support. And really the first is because food is that critical lifeline that everybody needs. But the second reason is because we need to keep people safe. We need to keep people doing what they need to do to socially distance themselves. We can't have people who are at risk going out into the community. We can't have people who are at risk going out into the community. And it's easy to say that, you know, I'm not going to go political on you here, but if you're a politician in some other place and you just decide there's going to be a stay-at-home order, your community partners need to figure out how to actually execute on that so it's effective for the community. And that's where we've stepped in. So we do a lot of other things, but that's it about food.
Which is phenomenal. It truly is phenomenal. And what a difference you're making. Now, housing. I understand that you've tried to help with that area also.
Yeah, so housing is, you deal with housing in a very collaborative way. We're part of the Greater Nashua Continuum of Care, and I personally actually chair the Continuum's Youth Homelessness Subcommittee. When it comes to housing, we have a call twice a week. Actually, I just had it about half an hour ago with housing partners in the community, including our shelters, the Rescue Mission, the Soup Kitchen and Shelter, Front Door Agency, Family Promise, Marguerite's Place, Public Health Department, the Welfare Office, ourselves. And so we get together and we talk about, so what are the specific and evolving needs? One of the things that's evolving rapidly is that the state of New Hampshire is looking to and finalizing a program where there will be an overflow shelter. In all likelihood, I'm going to say this 95% likely, there will be an overflow shelter for an undetermined amount of time, perhaps 3 months, and that'll be at the Daniel Webster College, the facility it's now foreign owned and it's not an operating college, but the state of New Hampshire has been negotiating with the owners to do that. The National Guard will be setting up that facility. It's intended to house somewhere around 45 people from the community as overflow. I'm going to tell you that it's not meant for people who are COVID positive. It's meant for people who are overflow from the shelters so that the shelters can effectively socially distance within their facilities. Our involvement with that directly is that we're going to be the subcontractor. United Way is going to be the subcontractor for that facility to develop and maintain a food supply chain so that we'll have breakfast, lunch, and dinner served to that temporary community of individuals. And I'll tell you the reason why I wanted to step in and do that. It's because 2 things. One is United Way. We're uniquely positioned with business relationships to establish that supply chain. We know who the restaurants are. We know who the facilities are that can do this. And we can establish that pretty easily. Equally important, as a member of the community and having been a member of the business community myself and a member of the Chamber of Commerce, we are 100% committed to making sure that those food supports also have a benefit to the local business community. So I'm looking to do this in a way that contracts with local restaurants, local caterers, put them on a rotational basis to help generate some income for them at this time, and also do it in a way that benefits the community at the shelter. So that's really our involvement, is staying in touch with the Continuum and helping to support the shelter as it moves forward. The other big area, if you don't have other questions about that, the other big area which I think we should talk about is how we're supporting the nonprofits in the community as we move forward.
Please, I was going to ask you that, so go ahead.
Okay, so the other really big thing that we've done at United Way, we've always been, and this is in our blood, we've always been the organization that is there as a collaborative partner to support nonprofits in the community. My job at the end of the day is making sure that our nonprofit partners are healthy and stable in a way that allows them to support their clients. So very early on, we established a COVID-19 emergency response relief fund, a dedicated fund in which we've raised money that can be used to support those nonprofits. And the funds that we've raised through that initiative has helped to support them in two different ways, actually. The first is that we've been making grants to those nonprofits to help to support their needs that they hadn't foreseen. You know, the world of coronavirus means that organizations like Revive Recovery need to find ways to serve their clients from a remote distance. And it means that organizations like the Soup Kitchen and Shelter need to purchase supplies to clean their place in a way that they hadn't previously. And it means that organizations like Home Health and Hospice need to purchase PPE that they hadn't previously purchased. And it means that organizations like the Rescue Mission need to find infrared thermometers so that they can screen people. So these are all things that are purchased and hadn't been planned for. And it also includes, overtime that people hadn't planned on because they needed to bring in extra help to clean the place, or maybe even rent because they had to close and they don't have a revenue stream anymore. So we've made thus far over 30 grants, targeted micro grants. Those are small grants, about $1,000 each. I set up a very, very easy application. It doesn't look like any United Way application that they've ever seen because it takes them about 10 minutes to fill out. Like if they really take their time, it takes 10 minutes. And the process for evaluation is basically they email it to me and my colleague Liz. I say, yep, that's good. I write them a check and off it goes. So they're going to get that money very, very quickly in an extremely streamlined way. The other thing we're using that money for, and we've also spent thousands of dollars on direct purchases. Those are things, I'll give you a couple of examples. So far, we've purchased and distributed over 3,000 rolls of toilet paper, over 90 gallons of hand sanitizer, over 25 infrared thermometers. We've also solicited donations for PPE. For example, we received a donation from our friends at Saint-Gobain for 1,000 medical masks that they actually air freighted to us from their plant in San Diego. Those items, whether we purchase them or they're donated to them, we're coordinating all of those donations, getting out to the nonprofits. So they don't have to either pay for those items or they don't have to spend time sourcing those items. We've dedicated ourselves to finding them. So if an agency says, we need this thing, well, United Way is going to try and find a way to get it for them. And if I can't find somebody who's got it, then we're going to buy it. And we're going to make sure they get it because we want them focused on doing their job in the community. And that's one of the unique roles that United Way can play, helping to coordinate and get things out into the community. So those are really our big areas of emphasis. As I said in the beginning, myself and my colleagues Liz and Sarah, we're not doing a single thing that we were doing 2 months ago. This is not anything we envisioned as our normal job, but it is a job that I think all three of us love. I feel comfortable speaking for them and saying that I think we've kind of found our groove. We're doing what we were called to do at this time.
And we're all very fortunate for that. And I want to ask you, with all of the balls that you are juggling, there is a financial impact clear across the board, as well as for the United Way. What supports do the United Way? What do you need?
Well, a couple of things that we need. First of all, financial support is critical because we're burning through, I'm burning through cash at an extraordinary rate. As soon as I get dollars into the COVID fund, they go right back out. And that's the whole purpose. That's not a complaint. That's just a fact. We're raising that money to support the community. So the first thing I would say, any of your viewers who wanted to make a donation, it's pretty easy to do. Is it okay with you if I tell them how?
Please.
So you can do that online. We've got actually the easiest thing is to go to our website, because our website, I should talk about that, has been set up to become a resource center as well. So if you go to unitedwaynashua.org and you click on the big, huge button right in the middle of the homepage that says COVID-19, there's several pages that we've set up. The first of them is about our emergency relief fund. and it talks about how you can make a direct donation to that fund right there electronically by a secure link, credit card payment. It also is possible to mail us a check to United Way and just put COVID-19 on the memo line so we know that that's what it's for. So we do need those supports. Any businesses that want to support us, we've had a marvelous, really fantastic outpouring of support from the business community as far as companies jumping on board to support this effort, mostly because they realize that they're part of a community as well. And they might not be able to do a lot with their business, but they can help to support this fund that does a lot for their employees and their families. So we need that support. There is also a page set up on our website that talks about resources and donations. Those are in-kind donations, things that we know that our nonprofits are looking for. So for example, if you go to that page, one of the things you'll see, for example, is I need diapers right now. Diapers in larger size, in small and larger sizes. Everybody wants to give you baby diapers because babies are cute. So I'm overwhelmed with size 1, 2, and 3 diapers. To be honest, as great as that is, I could use some 4s, 5s, and 6s. So those are the kinds of things we're looking for. And we update that list frequently based on what we're hearing from our partners for their needs. Another example would be Home Health and Hospice Care is looking for iPads. They need iPads to support their home health clients from remote and to provide a connection to them in the community. So there's a lot of that's on there as well. The third area of support is there's a page there called Dine United. Dine United is a program that we just launched this week. That's a program where we've partnered with local eateries. At this point, we have 15 eateries in the program. Every day, you can order takeout from one of those eateries. You just say that you're ordering because of United Way. Mention United Way, mention coronavirus. I don't really care. They're all pretty good at tracking these things. And they'll donate a portion of their sales to our coronavirus fund. We set that up with an eye toward not the portion they donate is only on the sales that are generated by the program, because they're all hurting right now. So I don't want them to give us money that they would just otherwise be making. I want them to keep that in their own pockets. It's only on the incremental sales that come from United Way. Today, I'll just mention, if you're hungry right now, and I suspect this program won't be aired right now, but just to give people an idea, as of Thursday, April 23rd, if you ordered today from UU Bistro or La Belle Winery in Amherst, said United Way, they would donate a portion of their sales to our coronavirus fund. So you eat great food, support a local eatery, help the community. What kind of a better deal is there than that?
Wonderful. You have seized the opportunity to use your wonderful heart that you have and your wonderful mind to be very creative and come to a variety of solutions to help our entire community. And kudos to you. Really, truly much gratitude and thank you to you. It's not an easy thing that we're going through, and none of us know how long it's going to be, but you have set into mechanism some phenomenal things that will be remembered by our community forever. I am sure of that. When it comes to state funding and federal funding, are you seeing anything coming your way to support you, or is it basically the private donations that you need now?
Well, that's a good question. So like many nonprofits and many businesses, we also applied for the Payroll Protection Program. And we were lucky enough to work with a bank that really helped us with that process. Our bank, and I know there are a lot of banks here locally that are working on that. Our bank happens to be Enterprise Bank, and they did really a fabulous job helping us to steward that process through with the Small Business Administration. So we were awarded payroll protection funds in the first round of funding before it ran out. And we'll definitely be using that to help to offset some of our payroll costs and our occupancy costs for the next couple of months. Other than that, really the funding has all been private donations and corporate donations. What I did want to say before we're done is, and I appreciate your kind words, I want to remind everybody that I'm just the good-looking front man with the coronavirus beard. But I am not what's making this happen. What's making this happen is the support of my colleagues, Liz and Sarah, the support of my fabulous board of directors, the support of all of our partner agencies in the community, and perhaps most importantly, the support of our volunteers. We have over 200 volunteers at this point, have logged over 2,000 hours of volunteerism in the last 4 weeks around coronavirus, just with United Way. So it takes a village, and we're really proud to be part of the village.
And I would like to add, Mike, which is very important. In order to do everything that you're doing, it takes an excellent, committed, and dedicated leader who cares. So thank you so much for making a huge difference in our community. And if you could again mention your website before we close, I'd greatly appreciate it.
Sure. Everything that I talked about can be found at the United Way of Greater Nashua website. That's www.unitedwaynashua.org. You have to be careful because there are over 1,000 United Ways in the country. So it's unitedwaynashua.org. And if you wanted to make a donation, you could also just donate directly to our little tiny URL, which is tinyurl.com/UWGN COVID-19.
And if anybody wanted to help you in volunteering, they would go to that website also.
That's correct. And they would be directed to contact my colleague, Sarah, who would connect them with the right opportunity.
Mike, thank you so much for taking the time to be with us today and to help us to inform our greater community of the wonderful things that you're doing. And my sincere gratitude to you and your staff and all of the volunteers and businesses that have come together and truly are standing united to make a difference for all. So thank you. Be well, be safe, and take care.
Thank you. You as well, Yvonne, and really appreciate you helping to get the word out for us in the community.
My pleasure. Thank you.